Hello, thank you for watching Spotlighting Jonesboro on Channel 24. Today we're talking about a very specific topic in dementia and Alzheimer's. And with me I have a very special guest. It's Dr. Wise with St. Bernard's Behavioral Health. Dr. Wise, how are you doing?
I'm good. Thanks for having me here.
Good. Now let's start with just kind of the high level. What is dementia? And then how can we recognize the early signs of it?
Well, dementia is actually a group of symptoms that affect both intellectual and social functioning, and they affect your social and intellectual functioning to the point that they interfere with your day-to-day activities. There's actually many types of dementia, with Alzheimer's dementia being the most common and well-known type of progressive dementia. On the Alzheimer's Association website, you can actually find a list of the top 10 warning signs that you have dementia. And what is important to keep in mind is that a diagnosis of dementia is not made from just having memory problems alone. In order to have a diagnosis of dementia, you need to have problems with 2 or more brain functions. So problems with, say, memory and judgment, or memory and language. In addition, it's important to keep in mind that you will have a change in function from your previous level of functioning. And one sort of example that I give to patients is to think of a time that's all happened to us, where we've been to the store and parked our car, come out of the store and forgotten where we parked our car.
Right.
Well, eventually we can all problem solve and figure out where we parked our car. A patient with dementia, on the other hand, may not only forget the location of their car, but lose the ability to adjust to the situation and to problem solve and find the lost car.
Right. Now, with the top 10 warning signs, is that something where, say for instance, I read number 1, memory loss that disrupts daily life? If that's, if I have that, is it something that I should worry about? Or is it something that, maybe if I have 3 or 4 of these, that's when I need to start worrying and getting checked out?
It's the latter. You want to be wary of having memory problems, but it really has to be more than one thing going on in order to for a physician to make the diagnosis.
Okay. Now, and how would a doctor diagnose dementia?
Well, the primary tools used to make a diagnosis of dementia can be completed in a clinic setting. And what your physician will start with is getting a thorough history. For example, they're going to want to know how you're functioning in day-to-day life, such as preparing your meals, taking your medications, paying your bills, that type of thing. And they'll also want to get information from family and friends. And in addition, we'll do cognitive tests. Now, these tests help us to reliably gauge the degree of cognitive decline. We'll also want to make sure that you're in general physical good health with the physical exam, and we'll get laboratory data because there are some medical problems, underlying medical problems, that can actually interfere with your thought process and your thinking.
Right.
And then finally, we always screen for mood symptoms because there is a link between depression and having memory problems. So an untreated depression would be something we would want to address.
Sure. Now, and as with many, I guess, diseases or illnesses, early detection is vastly important. But what benefits are in place here for catching dementia at an early stage?
Right. Well, hesitancy to come to the doctor when you're having memory problems is more than understandable because a diagnosis of dementia is such a dreaded diagnosis. But there are benefits to come in early. And one of those reasons is that there are some symptoms that we can treat that may even be reversible. So if there is something medically going on affecting your memory, we can go ahead and get treatment started for that. In addition, we can offer patients drug and non-drug interventions that can ease the burden of the disease and slow the progression of cognitive decline. And probably most importantly, if you come in and get an early diagnosis, it's going to empower you to be able to make your own decisions for your future and the kind of future that you want to have.
Okay. Now let's change directions just a little bit from treatment to more of a prevention. Are there any proven strategies to preventing dementia?
Well, we know there's no cure for dementia. We know there are some risk factors that we can't change, like our age and our genetics. But there are some risk factors that we can modify that can be protective for the brain. And what research is showing is that if it's good for your heart, then it's good for your brain. And a lot of us are already familiar with the cardiac health information. So stopping smoking, minimizing alcohol intake, keeping your blood pressure under control, keeping your blood sugars under control, lowering your cholesterol levels, having a nutritious diet, being physically active and trying to exercise every day. That's very good for your brain. And also exercising your brain with new activities or crossword puzzles or learning a new skill can be very beneficial as well.
Okay, and for the caregivers that are looking after those with dementia, do you have any tips for them?
Well, it's important for caregivers to keep a calm, stable home environment for their loved one. And a consistent routine is very calming for a patient, so a consistent daytime and nighttime routine. In addition, it's very important that caregivers themselves find support from family and friends and support groups in the community.
Sure. Now, this may be a little off, but are there any specific populations or demographics that are more or less at risk?
Well, there are actually many types of dementia. And so depending on the type of dementia that you're diagnosed with, there's a certain set of risk factors for that type of dementia.
Okay.
So when we kind of go along with the Alzheimer's dementia, some of the risk factors we already mentioned earlier. But for, say, a vascular dementia, you're going to be more at risk if you have cardiac problems, vascular problems, and that type of thing.
Okay. All right. Well, thank you so much for sitting in with us. A ton of information in a very condensed segment, but certainly would encourage anybody to take a look at the top 10 warning signs again on your screen. And if you have any of those things, please contact a physician or yourself, I guess, immediately to get a diagnosis. Again, thank you so much for sitting in with us.
Thank you for having me.
Thank you guys for watching.